So, a very good morning, everyone. Hope you're all doing well. Today's lecture will be a detail about my endocrine and diabetes lecture series and how it is going to help support you in your exam preparations for your exams, plus in your clinical practice. So, as you all are now aware that my entire lecture series is available with a nominal one-time fees for the subscription, which gives you all access to the existing 76 lectures. We'll look at what all these 76 lectures are in the next slides, plus all my upcoming lectures and videos in the future. This will definitely help to support your preparation for various endocrinology exams like the specialty certificate exam, European board exam, and other endocrinology board exams all over the world. They are extremely helpful for clinical practice as well. If you wish to subscribe to this full lecture series, just get in touch with me directly through my WhatsApp number, which is 00971557434794, or you can email me on mazirules@gmail.com. So let's go through an overview of these 76 lectures, which are currently part of the lecture series. So in diabetes, there is a significant proportion of 23 lectures on diabetes, different topics. We have case-based approaches in all the lectures. So diabetes in pregnancy cases, then DVLA guidelines, classifications of diabetes mellitus, perioperative diabetes guidelines as per the latest JBDS updates, diabetic retinopathy, which includes the diabetic eye screening guidelines, COVID-19 and diabetes guidelines, diabetes cardiovascular outcome trials, calculating and adjusting insulin doses, insulin carb ratio, insulin sensitivity factor, and carb count. So a lot of practical lectures as well. Then there is a detailed session on insulin pump education, the basics and the advanced training. There's a session on case-based approach to scenarios of non-diabetic hypoglycemia. Hypoglycemia treatment as per the guidelines, JBDS guidelines, steroid-induced hyperglycemia and steroid-induced diabetes, again as per the JBDS guidelines, diabetic ketoacidosis, excellent session from Dr. Hia, again based on the Joint British Diabetic Society guidelines. Then there is a session on the hyperosmolar hyperglycemic non-ketotic state or HONK, again based on the guidelines. We have a latest update in terms of DVLA, which was published in 2023, and I made a session on that as well, which is the latest update as per 2023. Then there is a session on diabetic neuropathy, where I've covered the NICE UK guidelines as well as the ADA 2024 recommendations. There is again a very good practical session about CGMs, how to put the CGMs, how to interpret the CGMs. There is a session on diabetes and Ramadan, where we have discussed in detail the IDF-DAR practical guidelines for diabetes in Ramadan. Then there is another CGM session on application in clinical practice, understanding and interpreting a CGM report, and the ambulatory glucose profile. Two more latest sessions which I had recently released was the mock diabetes exams. This contains a lot of MCQs which have previously appeared in the diabetes section in the exam paper. So it's an extremely important high yield sessions, which is part 1 and part 2 for the mock diabetes. Then there is end of life guidance for diabetes care, again based on the JBDS 2023 guidelines. And we have recently started the journal club, in which we are going to go through different articles which are recently published in peer-reviewed journals. The first one of this session was based on tirzepatide and its benefit in sleep apnea. This was again based and released in June 2024, based on the recently published article. And there will be many more journal club sessions coming up every month. Then there are 16 lectures. These are a lot of MCQs in these 16 lectures. They are all the high yield topics. They are based on the previous exam recalls, which have appeared in the specialty certificate as well as the European board exam. And there is a session on the Oxford Handbook of Endocrinology, 4th edition, important pearls from those edition as well. So as I mentioned, different sessions. One session on the recalls of 2024 SC, which recently happened. Again, they are not like the full 200 questions, but they are important themes from this particular exam. There is a session on the latest endocrinology and diabetes drugs. There is part 1 and part 2 for this session. So these are the recent advances in endocrinology and diabetes and the drugs and the mechanism of action of the new endocrinology and diabetes drugs. There is a recall session on SC 2023 exam. There is an exam lab session. There's a session on all the top images of endocrinology and diabetes which commonly appear in the exam. There is a session on pearls from the Oxford Handbook of Endocrinology and Diabetes, 4th edition. There are 3 excellent sessions on high-yield topics for the section of thyroid. All these are themes which have appeared in the previous exams. And there is part 1 and part 2 adrenal, again covering all the adrenal themes which have appeared in the previous exams. There are 3 excellent sessions given by Dr. Rana. These are about the high-yield endocrine diabetes concepts. It serves as a very quick revision for your exams. There is part 1, part 2, and part 3 to it, and all these 3 sessions are excellent. There is a previous exam recall for 2021, 2022. Again, there is one more session on top resources to study for the exams, especially the specialty exam and the European board exam. As regards thyroid, we have 7 lectures. We have the lecture on the thyroid uptake scan interpretation. There is a lecture on case-based interpretation of thyroid function test. We have an endocrine emergency, which is thyroid storm. Then there is dynamic risk stratification and TSH suppression in a case of differentiated thyroid cancer given by my professor, Professor Mark Strachan. We have NICE thyroid guidelines, which were released in 2022. Then there is a Graves ophthalmopathy session, case-based again, based on the UGOGO 2021 guidelines. Then I've detailed the case-based approach and done a session on 2023 Bethesda system for reporting thyroid FNC, which was released in 2023. As regards adrenal, there are 7 lectures. Case-based approach to all Barter's, Liddle's, apparent mineralocorticoid excess, and Gentleman syndrome. Case-based approach to hyperaldosteronism and cons. Case-based approach to adrenal insufficiency, pheochromocytoma and paraganglioma. Case-based approach to adrenal incidentaloma. There is a latest guidelines from Society for Endocrinology for fasting with adrenal insufficiency. I've done a session on that. And there is a very recently released guidelines in 2024 about glucocorticoid-induced adrenal insufficiency, which was published by the Endocrine Society and the European Society of Endocrinology, and I've done a session on that as well. There are 2 excellent lectures by Dr. Van Murugan on lab endocrinology, extremely useful sessions for those preparing for the endocrinology exams. Pituitary sections, we have 7 lectures. This case-based approach to Cushing's, acromegaly. There is a detailed session on different MRI pituitary image interpretations, which are commonly asked in the exams and have appeared in the previous exams. There is a evaluation of Cushing's, as I told you, in 1 session, and treatment of Cushing's in 1 session, because those are more extensive sessions over 1 hour each. Management of prolactinoma in pregnancy, again via case-based approach. Then pituitary apoplexy, and excellent session by Dr. Van Murugan on case-based approach to polyuria and understanding water deprivation test. Here he has covered the details of cranial and nephrogenic diabetes insipidus. Inherited endocrine syndromes, we have Cowden syndrome, we have MEN1 syndrome, and there is also a session on immune checkpoint inhibitors, which are so commonly asked in the exams nowadays. Every year and in every diet, there is at least 3 to 4 questions on immune checkpoint inhibitors, which has been asked, and the endocrinopathy which it causes. So there are sessions on Cowden's, MEN1, and immune checkpoint inhibitor-induced endocrinopathy. As regards the reproductive endocrinology, there are 7 lectures. Session on case-based approach to gynecomastia, case-based approach to congenital adrenal hyperplasia. There is a session on case-based approach to transgender women or trans women. There are 2 sessions on hirsutism. One is for evaluation and diagnosis of hirsutism, virilization, and PCOS. And then there is a session on management and treatment of PCOS and other causes of hirsutism. There is a case-based approach to precocious puberty in girls. And based on the recently released guidelines, I've done a session on the PCOS evidence-based guidelines for assessment and management. This was released in 2023 by the European Society of Endocrinology. As regards calcium and bone metabolism, there are 3 sessions: case-based approach to hypocalcemia, hypercalcemia, and osteoporosis. And in this, I have covered the NICE and the NOG guidelines, which appear in the exams. There are 2 lectures on lipids and hyperlipidemia. First session on familial lipid disorders and familial hypercholesteremia. Very favorite topic for exams. So again, very extremely important session. And based on the latest guidelines released by the NICE on 2023, I've covered the NICE lipid guidelines, where I have covered significant sections of these guidelines, again, all via case-based approach. Then there is one session in Kalman's syndrome, where I have covered the approach to a case of delayed puberty, covered the topics of constitutional delay of puberty, and even Klinefelter syndrome. So this is again a very extensive session over 1 hour, covering Kalman's, Klinefelter's, and CDGP. And these are some of my upcoming lectures. I'm going to cover the JBDS enteral feeding guidelines in a diabetic patient, released in 2024. As I promised, there will be journal clubs at least once or twice every month, where me and Dr. Hia and even Dr. Mel Murugan will be discussing some recently published articles in peer-reviewed journals. We have a case-based approach to Turner syndrome coming up, in which I'll be discussing the clinical practice guidelines for the care of girls and women with Turner syndromes. And this is based on the recent publication in 2024, where they had covered the proceedings from the 2023 Aarhus International Turner Syndrome meeting. This is a further extension to the Cincinnati guidelines, which were released in 2016. There is a case-based approach to different endocrine disorders in pregnancy. There'll be a case-based approach to diabetic foot ulcer. I'll try to cover as many recalls from the recent exams of SC and European board exam. Case-based approach to amiodarone-induced thyroid dysfunction. Case-based approach to transgender men. A case-based approach to short stature. Case-based approach to DSD. Case-based approach to precocious puberty in males. Case-based approach to male hypogonadism, including details about testosterone replacement. Case-based approach to different endocrine emergencies, and many, many more topics are lined up. So again, I'm trying my best to get this lecture series. I mean, it's an ever-growing resource for you all, and it will be great if you all subscribe to this lecture series. And I'll keep trying my best to upload more and more lectures in the coming weeks, months, and years. And again, remember, the access is lifelong. You'll get access to all the existing lectures, plus all my upcoming lectures lifelong. So thank you so much, and please do subscribe.